had an interesting 15 years or so in my career because for 7 years or so I was in the central government of UK where when we thought about investment, these were very much macro investment decisions on the allocation of state resources. And for the last 7 years, I've worked for a not-for-profit called Social Finance, which has been much more involved in investment into social enterprises and into projects, which is a different sort of paradigm of organisational and venture investment. And really the conclusion that I want to sort of start with and leave you to is that both paradigms are important when we think about investment into long-term care. And I'm going to illustrate that just with example of one project. We can go to the next slide, the slide after that, slide after that, one more slide. With an illustration of one project to seek to improve people's health and well-being, reduce their movement into residential care by helping address loneliness and isolation in one part of England, in Worcestershire. The next slide. This project was conceived as testing a community-based response to loneliness and isolation, which affects at least 1 in 10 older people in the UK. By linking them up with health services and social care, with an assessment which is made of their needs, very much person-centred in terms of their aspirations and interests, then links them up with a volunteer to help them develop reconnections, whether that's social activities, overcoming emotional challenges, and tying them into a more interdependent community. I'll go to the next slide. And the one after that, actually. I'm going to be brief on this. I just wanted to say a teeny bit about the process of the social return on investment analysis, which this was an example of. When we looked at this area around reducing loneliness and isolation, there was actually a relatively poor literature review on really assessing the economic impact of reducing loneliness and isolation. But there are some promising studies indicating the relationship between reducing people's loneliness and their reduced need for residential and healthcare. The broad conclusions of that analysis is that there is an impact of reconnecting people, both on terms of people's short-term resilience and therefore their likelihood of needing care in the short term, but also their long-term well-being and the development of the reduced likely development of dementia, coronary heart disease, and other conditions. And that gave us a broad framework. We then, moving to the next slide, and you don't need to see all of this, we then worked with our colleagues in the London School of Economics to refine that analysis, which broadly showed that on the economic basis, there was a slight positive case for investing in these sorts of preventative measures rather than into more traditional institutional care. I think that reinforces the find that these are not enormous economic gains in the way that investment in skills or early years would be, but it's an important framework to consider. We'll move to the next slide as well. I also think I'd reinforce the fact that in these areas, looking at outcomes is as important as just the economic benefits. And we used and continue to use a measure of looking at loneliness, which is well validated across the UK and other countries in a 4-point scale. But the really interesting thing about the project has not been the macroeconomic analysis, much as that is interesting. The real thing which is exposed is the enormous variability in the quality of delivery of similar types of projects by different providers. And in this organisation, we started off with 7 different, usually community-based providers of support and care. And what we found is that the the approach which was taken, but also essentially the fundamental drive, effectiveness and productivity of different services varied enormously. And I suspect that is the case in many projects which span the boundaries between informal and formal care. And in that context, the allocation of resources between different organisations becomes really important. How does the social economy manage that allocation to providers? In the case of our project here, because it's one project with 7 providers, we were able to kind of quite quickly move resources around. We dropped 3 providers, and we started to refocus on others, and we improved their overall productivity. And so I think I would just, add to this conversation that alongside the macro analysis of social return on investment in long-term care, all countries need to think about what conditions they're putting in place to enable the allocation of resources to different providers within a social economy, the stimulation of quality and of innovation within that. Thank you.
Thanks very much.